In one of my recent shorts, I have talked about the safest period of pregnancy, which is between 20 to 30 weeks. But the most important time probably is the third trimester, the late pregnancy, during the term pregnancy. This is the time when a serious catastrophe of a late fetal death, sudden death of the baby in the womb can happen. Why does it happen and how we can prevent that? To know more about these topics, please subscribe my channel so that you become aware of these obstetric and gynecological topics. Now, normally, the placenta, which is a baby's organ in the womb, usually supplies the nutrient and oxygen to the baby. Now, this placenta has a huge reserve, but sometimes this placenta can be very seriously affected, and due to several conditions which I'm coming to later, which can affect the supply of nutrients and oxygen to the baby, and these supply can come down to below a critical level, and sudden fetal demise or fetal death can happen. Now, if the mother develops diabetes, has preeclampsia, which I have talked about in one of the videos, had previous history of late fetal deaths, preterm labors, rupture of membranes, then the doctor and the obstetrician must be very, very vigilant. This is very important because the modern neonatologists and pediatricians are saving very, very premature babies from as early as 26 to 28 weeks onwards. The hospital where I work, one baby was saved which weighed just 440 grams at birth. Now, so these modern neonatologists and pediatricians, they tell us one thing: give us a premature fresh baby, we will save that baby, but don't make the baby half dead or almost dead in the womb and then give it to us. It would be very, very difficult to save that baby. So you have to be very careful, and if needed, an early delivery has to be done. But what causes exactly this late fetal deaths? As I said, the placenta gives the support, the life support to the baby. If the placenta gets affected, then it can happen. If the baby develops any metabolic disturbances, thrombosis in its blood vessels, especially the umbilical cord through which it is getting the supply, if there is any thrombosis in this umbilical vessels, if the supply has gone down, then the baby can suddenly die. Now, ultrasound examination, especially Doppler ultrasound, can tell us about these things. This is a fantastic technology to know whether the baby is in distress or not. If there is any reduction of the flow between the mother and the baby, the ultrasound will detect, and the baby will stop growing. So the baby, if stop growing, like for example, it's known as the intrauterine growth retardation or small for date baby. If it is below the third centile, baby is grossly less developed, then something is wrong. The baby is not getting the supplies from that. Now, along with that, if the Doppler ultrasound says that this baby is getting less blood supply from the mother, in that case, you have to deliver the baby early. And if you have a good pediatrician and neonatologist, discuss with them, and many of them will tell, okay, get this baby delivered so the baby does not depend on the mother anymore, and we will supply from outside whatever necessary. Don't think that a premature baby after delivering, after being delivered, after being born, will stop growing. It will be growing every day. It would be growing in front of our eyes. Womb is a dark place filled of fluid, and if the baby screams from there, because of lack of oxygen, we won't be knowing. The only symptom which can happen is the reduction of baby's movement. And if there is a reduction of baby's movement, the patient must immediately alert the obstetrician. Now, if there is Doppler flow abnormal, I remember a case who had repeated deaths of babies at 30 weeks of pregnancy. Now, this patient lived in Guwahati, and in the current pregnancy, the ultrasonologist said that there is reduction of movement in the flow between the mother and the baby and warned the patient. Patient immediately flew to Kolkata, and she was tried to prolong the pregnancy a little more, which was a wrong decision because already the blood flow, the carrying of oxygen from the mother to the baby has been curtailed. You cannot wait. There's only 50-50 chance you get the baby delivered, and if the baby is okay with survive under the modern neonatologist. So if there is reduction of movements, is there is growth retardation, gross growth retardation, and the baby is not growing which it should be growing, like the growth has flattened for the last several weeks. If there is less of fluid, the amniotic fluid in which the baby is floating, these are warning signs, and these are, if these come up, then in that condition the obstetrician must think that this lady needs an early delivery. And if an early delivery is done, these late fetal deaths can be prevented.